지금 말레이시아의 연자 수라야 유소프 교수를 소개합니다. 이분은 말레이시아 정부에서 하는 치매 가이드라인을 만드셨고 조호르바루에 계시면서 치매 케어 그룹을 만들어서 서포트를 하시는 아주 열정적인 연구자이고 이 사회의 어떤 활동을 하고 계십니다.
Thank you, Professor Su. 안녕하세요. That's one of the three Korean words that I know, not many. Okay, the second is kimchi, and the last one you will hear later. Right, okay. So my given talk today is Dementia Care in Malaysia, the costs and challenges of caring. Oops, too fast. Not very good. Okay, 2014 is not a very good year for Malaysia, as I'm sure you all know. It's a time of disaster for us, actually. You are all aware of the three aeroplanes that we lost, right? And after that, at the end of the year, we have a massive flooding, actually, which affects the northern states of Malaysia. A lot of people suffer from the floods, right? It's an annual event, flooding in Malaysia, because of the monsoon season, but this time it is really, really bad, right? Okay, I hope you know where Malaysia is, right? It's a country above the little red dot, the powerful Singapore, right? So that's us, the arrow. We are two different. We have two different parts of Malaysia. One is the West Coast, where I come from, and the other is the East Malaysia, West Malaysia and East Malaysia, right? Just to give you an idea, Malaysia is unlike Korea or Japan. We are multi-ethnic group. The largest group is, of course, the Malays. I am Malay, and the Malays are 100% Muslim. Then we have the other population of Chinese, which makes up 23% of Malaysians, 7% Indians, and the East Malaysians are made up of various indigenous groups. They comprise 11% of the population. And we have others as well coming from Thais, the newer migrants population of Indonesians as well. Right. In terms of GDP, our GDP is not very high, and our minimum wage is actually very little, which is about less than $250. Right. What I'm going through is to give you an idea of the healthcare delivery in Malaysia, which is different from Korea or Japan, a bit on the epidemiology of dementia, the state of dementia care deliveries and facilities that we have, and Prof. Su asked me to talk a bit on the health financing and insurance. Right, this is the health delivery of care system for Malaysia. We have two systems, the public services and the private services. The public services are mainly under the jurisdiction of the Ministry of Health as well as the Ministry of Education. So all the academics, universities are under the Ministry of Education, and they operate under a separate budget. The Ministry of Health, under the Ministry of Health, most of our public healthcare system are provided by the Ministry of Health, at least 90% of it. They have the public health services, which the community, which operates in the community, and they have the hospitals division as well. So there's two big divisions there. Under the public health system, we have the various healthcare clinics which delivers primary care. And these are all subsidized by the government. And in the hospitals, in the districts, we have the referral centers, which are the tertiary centers. And each of the states, we comprise of 13 states in Malaysia. So we have states hospital as well. In certain parts of the state, they have 3 state hospitals operating, and in some smaller states, we have only 1 state hospital operating. And then we have the various small district hospitals, which are run by medical officers. So these are mainly non-specialist district hospitals. Right. The universities, other than the Ministry of Education, some universities are corporatized as well, and they are also private universities. The private healthcare delivery are all under their owner. They don't operate under any of the jurisdiction, and they affect all sectors of care, including primary care and the secondary hospitals. Okay. So this is how the healthcare system is usually delivered. We have health centers, and these are the primary gatekeepers, right? Health centers are free of charge, so anyone can come to the government health centers without paying a single cent, right? So we have various health centers operating, and these health centers do provide, in certain places, they do provide mobile team as well to far outreach place. And in East Malaysia, where they have isolated villages, they do provide the flying doctor services as well, right? So the health centers, as the gatekeepers, will usually refer cases to the district hospitals, right? Who then will make the referrals to regional and other state tertiary centers if they are unable to cope. Right, and outside of this, we have a community care, long-term care, which are sheltered home, residential home, nursing home, and psychiatric nursing home as well. And these are all resident-based. Okay, our National Mental Health Framework has been revised in 2001. Prior to this, we actually have a Mental Health Act. This is the, I'll take back that again. Right, we have a National Mental Health Framework in 2001, and this National Mental Health Framework actually defines the services models across the lifespan, ranging from child psychiatric services to adult psychiatric services and elderly psychiatric services. Right. And of course, we have the various acts and committees which have been set up to look after the elderly services as well. Our national policy for the elderly is only developed very recently in 1995. And in 1998, the government introduced the Private Healthcare Facilities and Service Act, which stipulates guidelines and regulations for nursing homes. Prior to this, nursing homes are mainly under the jurisdiction of the Ministry of Social Welfare, right? Okay, our national mental health policy is also very recent. It comes into being in 2000 only. And our Mental Health Act is actually, this is the renewed version of the Mental Health Act, which is introduced in 2001. And prior to this, we have the Mental Health Act of 1952. That was at the time that we were colonized by the British. Right, so the new Mental Health Act actually highlights 2 points here. It encouraged care in the community, and it also encouraged the setting up of private psychiatric nursing homes and extended care, right, as opposed to the older Mental Health Act, which did not stipulate these 2 important points. Right, okay, we shall move on. Right, there's actually, we do not have any specific policies on dementia. We do not have the National Dementia Strategy, but we do have small pocket numbers of dedicated psychogeriatric and dementia services, but these are all very recent events. We do not have a dementia registry, and in the Ministry of Health Science, because we are too busy providing services to the public, we do not have a rich research culture, right? Until very recently, when government encouraged the setting up of clinical research centers at all state hospitals, right? But what we have is the Malaysian CPG, and in the CPG we do set up indicators for the standards of care for dementia, and each of us actually out of our own initiative, we set up individual database for each of the hospitals. Right. Okay, we move on to the epidemiology of dementia in Malaysia. It's estimated that 50,000 people with dementia are in Malaysia, but many are not diagnosed. This is according to the Access Economics. By 2020, we expected double the amount of people with dementia that we have now. And by 2050, almost 500,000 people with dementia are expected to be in Malaysia. Right. The global, as you know, the global prevalence of dementia is about 6.1% of those aged 65 years and more. Right. There's lack of local prevalence studies on the dementia prevalence. According to the National Mobility for Health Services for Malaysia, the third version, about 20% of those aged 70 to 74 years have some degree of mental health problems. Right, there have been small community studies of the prevalence of dementia. The eldest is quite recent in 1996-97, where Prof. Krishna Swamy found a prevalence of 6% of Malaysians with dementia, and Sharina, who's a psychologist, found a higher prevalence of cognitive impairment, not really dementia, of 24%. The largest study that we have on the prevalence of dementia in Malaysia is in 2003 by the Institute of Gerontology, where it comprised about 3,000 population of those above the age of 60 years old. And she found a prevalence of 14.4% of Malaysians elderly with dementia. The higher number actually because of the high number of those in East Malaysia actually. So the results is actually a bit skewed, because in East Malaysians they use a totally different language than what we use in the West Malaysia, right? Because majority of tribal ethnicities, and there's not many assessors from each of the tribes, right? In long-term care facilities, Prof. Hassana in 1996 found that 45% of those people residing in nursing homes in Malaysia have dementia, and this was the high number of prevalence was again repeated by Prof. Dr. Al-Jawad in 2008. Right, so what is the state of dementia care deliveries and facilities that we have now? Right, so I'm going to go through the early diagnostic and treatment system first. Right, I have sort of summarized this into these tables, the services that are provided, where it's provided, who provides, who gives these services, and what are the services that are provided. Okay, in terms of early detection in primary care, we do provide screening. So anybody above the age of 60 years old can go to any of the healthcare centers and have a physical screen as well as a cognitive screen. We use mainly the Elderly Cognitive Assessment Questionnaire, which is a very short questionnaire designed by Prof. Kwa, developed by Prof. Kwa of Singapore. Malaysian and Singapore population are about the same. In fact, we are closely related to each other, right? And for some Muslim populations who miss the boat, they go every year for the Hajj pilgrimage to Mecca, and these people will also have to undergo both physical and cognitive screening as well. So we hope at least to catch a population of people with cognitive impairment or potential dementia to be referred to the secondary care later. And the primary care also runs various promotional and awareness programs in terms of health talk, video screening that they're prepared, and also to teach the elderly some forms of mental health life skills as well. At various primary care centers, we do encourage the setting up of senior citizens community club, and some of the health centers do provide gym and exercise programs as well, right? So in terms of linkage to the secondary and tertiary care, we do encourage coordinated and flexible referral flow to the tertiary or secondary care center. And in terms of in terms of secondary care, these are specialist services provided by the psychiatrist, physician, neurologist, and so on. So at the secondary care level, we do come up with algorithms for diagnosis and management of dementia. So we have CPD guidelines available. The last one was in 2003, and it is awaiting renewal at the moment. So I'm waiting for the next person to take over. Right, there are various neuropsychological tests which have been validated and culture specific. Although not many of them in the Malay language, it's a bit difficult to deal with multi-ethnic societies because we have to have three types of languages: Indians, Tamils, the Chinese, mainly in Mandarin, as well as the Malay. So you have to actually translate all these instruments. There are neuroimaging facilities at all the state hospitals. At most minimum, we do have CT scans. At least one state hospital in each of the state would have MRI facilities as well. We don't have PET facilities except for two states in Malaysia, which is in Penang and in Kuala Lumpur. But probably Johor Bahru will also be receiving one soon. We have anti-dementia medication. It used to be original, but now to reduce the cost, we do have a generic as well. We have all this, and in certain hospitals we do have community and home-based states. In a majority of the hospitals at state levels, the psychiatrists do provide community and home care service. Only in my center in Johor Bahru, we have community services specific for elderly people. Right, the rest of the states, because they don't have too many psychogeriatrics, so we sort of piggyback dementia with the secondary services as well. Rehabilitation services we do have at most of the state hospitals, but not at the district hospitals because of the lack of resources. We do provide training for the staff, not probably regular, rather sporadically, on dementia care of the frail elderly, and care of the caregivers as well. And we do have services for the caregivers and provisions of daycare in certain parts of the country, which we will go through later. Right. So in terms of tertiary care, of which the main part of the work is done by memory clinics, we don't have so many memory clinics in Malaysia. So we only have about 6 of the states in Malaysia with geriatric psychiatrists, with geriatrician, that provides memory clinics. Somehow or other, it's peculiar with Malaysia. The neurologists are not really interested in dementia care. So the bulk of the work is mainly done by the psychiatrist and the geriatrician, right? And these are the services that is provided at most of these memory clinics, right? Early diagnosis, challenging behaviors, addressing the ethical and medical legal issues, and also provisions of psychoeducation. Right, so we at the moment we would like to have inpatient services and respite care, but we can't because of the inadequate resources that we have. Right, so all these we hope to build up, but it has not been achieved as yet. Okay, so in terms of long-term care system, who provides the services, right? So we again have two service providers, the majority of which are provided by the Ministry of Social Welfare. So what the Ministry of Social Welfare provided will be sheltered accommodation, retirement home, and early residential homes as well. And these are all the providers, government, private, and charitable homes as well. All these under the Ministry of Social Welfare. Okay, the Ministry of Health only recently came up with the Private Healthcare Act. So most of the nursing homes are encouraged to register under the Private Healthcare Act, right? So because of the strict criteria before license is given, not many of the nursing homes are still registered under the Ministry of Health. Probably in the whole of Malaysia, we have less than 5 nursing homes registered under the Ministry of Health because the criteria is very strict. So the loophole is that a lot of them are registered under the Ministry of Social Welfare. There's no stipulation to say that you need to have a number of doctors, you need to have a number of nurses looking after frail elderly people. So there is a big loophole that the government has not been able to sort of arrest as yet. The psychiatric nursing homes are a very recent introduction with the introduction of the Mental Health Act of 2001. Right. At the moment, there's actually no psychiatric nursing homes that have been registered under the Ministry of Health as yet, because again of the strict criteria before license is granted. Right. So most of them hide under the guise of residential homes. So they are registered under the Ministry of Social Welfare, and we are aware of it, but apparently there's not much that the government can do at the moment. There's not much enforcement. So the government run residential homes mainly actually meant for destitute residents, but who are ADL dependent. So under this, they have about 8 homes, which comprise of about 8,700 residents. The healthy elderly with social problems are also probably placed under residential homes as well. And then we have 2 nursing homes under the Ministry of Social Welfare working together in tandem with the Ministry of Health, which provide services to about 220 residents. So they are staffed by nurses and social welfare officers. The nurses are seconded by the Ministry of Health to work under the Ministry of Social Welfare. In terms of private long-term care providers, there are a bit too many of them. They take in all sorts of patients, whether you are independent, and whether you are dependent. And the cost of stays varies. In certain places, it can be as cheap as USD 330, or it can be as expensive as 1,400 a month, right? So 1,400 times about 4, that's a lot of money for Malaysians. Okay, for the caregivers, our government policy, the government stands on its policy that the family is the cornerstone of care. So we don't encourage institutionalization. The caregivers usually get help from neighbors, friends, and volunteers as well. We do have paid workers for people who can afford it, where they take in foreign domestic maids from different cultures and language and foreign language. There are AD associations and support group in the country as well, although there's not many of them at the moment. So these are the places that have daycare centers specifically for dementia. We have in Penang, we have in Ipoh, in Kuala Lumpur, we have about 2 daycare centers which involves the community. In Malacca, we have support group, but they don't have any dementia daycare. In Johor Bahru, we have both support group and daycare. We doesn't have any of such support in East Malaysia at the moment, even though they are psychogeriatricians in Kuching and they are also psychogeriatricians in Sabah as well. But I hope that they'll be setting up at least support groups first, right? Because the population do need them, the community do need them. Okay. So, as in all other developing nations, the Malaysia old age dependency ratio is increasing, right? By 2030, 12.9% of our elderly population will be dependent. But the thing is that it's not reflected in those people who are working. The working population are expected to decrease. So by 2050, we will only have 5.1% of Malaysians working for every person who's aged 65 years or more. So this is the trend that we are going to see as what people in the developed nation is facing now. Right. So at the moment, we are still comfortable, but in future, we are not going to be so good anymore, right? So if you look at the cost of dementia in UK, the overall economic impact of dementia is very high at 26.3 billion. So this works to an average of about 32,250 per person. Right, and this consists of all these costs: your healthcare costs, your social care, your unpaid care, and other dementia costs as well. And similarly, in the US, the total monetary cost of dementia in 2010 was between 157 billion and 215 billion. And the monetary cost per person is either 56,000, varies from 41,000 to 56,000, and all these are paid by Medicare probably, right? So, but unfortunately, the cost of dementia care again will reflect the same as in other countries as well. So the health costs, the cost for hospital-based and community-based healthcare, the societal cost, community care and long-term facilities, as well as indirect costs. And this is again dependent on the stages of dementia, whether it's in the MCI stage, mild, moderate, and severe dementia stage. Right. Okay, there have been several cause-illness studies of dementia. As you know, the cost of care for dementia patients living in the community actually costs more than in the nursing home. But if it's calculated on per hour tariff, then the cost of nursing home is much higher than those living in the community. In an SR of 28 study, the cost more than double from mild to severe dementia. The cost of care for community living patients with moderate dementia are significantly higher than for patients with mild dementia due to the valued informal care. The total hours of informal care by primary caregivers double in moderate dementia patients, with 57% having paid domestic help to assist in care. This is according to the study found in Singapore. Right, so the cost of dementia care in Malaysia, how much and who pays for it, who provides? Okay. According to the WHO World Health Organization recommendation, the cost of care should be 5 to 6% of the GDP. But for us, it's very much lower as what is recommended by the WHO. We only give about 4.4% of GDP for healthcare expenditure, right? So health expenditure per capita in Malaysia comes to about 400 USD per person per year, right? That is for a Malaysian, for a normal Malaysian, right? So if you look at the graph on your left-hand side, majority of the cost will be borne by the private health insurance. A small minority will be out-of-pocket payment. Okay, in my country, it's a bit different, right? For public health sector, almost 100%, more than 90% are subsidized by the government. Unless, let's say, for an elderly person who comes into the hospital with fracture, right, you have to buy your own, if you need a knee replacement, you have to buy your own artificial knee, but the rest of the costs are subsidized by the government, whether it's the cost of surgery, hospital stay, are all paid by the government, right? For people who seeks help at the private healthcare facilities, then they have to pay out of their own pocket. So 57% of population are paid out of their own pocket. Only about 16% of Malaysians have insurance for their health, for any forms of hospitalization, any forms of healthcare. The other segment will come from other social programs such as your social security, social security organization. So Malaysians working in the private, most of them, if they are earning less than 3,000 Malaysian ringgit, less than 1,000 US dollars, they have to invest some into the social security organization. It is mandated by the government for those who earn less than 1,000. So the social security services will provide invalidity pension, will provide rehabilitation programs, but not so much as long-term care, which we will see later. There are other healthcare programs as well, such as the employment fund, where people in the private side will have sort of forced savings by the government. And this also will go towards their healthcare provision as well. But you can only withdraw the money that is saved after the age of 55 years old. Why 55 years old? Because that used to be the pension age for Malaysians for many, many years, until only recently we increased it to 60 years old. Only 2 years ago, we increased the pension age to 60 years old. But the 55 years remain as the cutoff for any withdrawals. Okay, right. There is a recent program which is government sponsored, actually, a research program on a long-term research grant that is given to various universities in Malaysia to come up with a neuroprotective model for healthy longevity among Malaysian elderly population, right? And these are the objectives that they have sort of set up. And one of the objectives, of which I am also involved, is to identify the psychosocial economic risk factors of age-related cognitive impairment, and to quantify the cost of care as well as the socio-economic impact of population aging of the nation. Right. With that third objective, we actually tried to find out the cost of hospitalization of patients with cognitive impairment in a Malaysian government hospital. And this involved about 6 public hospitals in Malaysia, but the study is only limited to inpatient stay, mainly because it's much easier to calculate. It comprised of about 600 patients. So the cost analysis was done this way. The overall costs were divided into 3 levels. The overhead cost centers, the intermediate cost centers, these include pharmacy, radiology, and so on. And then the final cost center, the cost of wards and the cost of all clinics. Right. Each cost center will include your capital costs, and this cost comes from the building costs, from the equipment and the furniture costs, as well as recurrent costs are also taken into account, which include staff salary and recurrent costs, except the salary, were then combined together. And at the end of it, we come to find the cost of providing services on a per patient, per day of stay basis, and this is called the unit cost. And the unit cost is equal to the fully allocated cost over the total units of inpatient stay. And at the end of it, we come up with the cost of care per patient per admission, and this is equal to the unit cost times the patient's long-term stay. So how much does it cost to look after these patients in acute care facilities? Okay, so this is the figure that we arrive at. Okay, for people with MCI, the mean cost of a hospital stay is about 3,000 USD, plus minus about 2,150. Length of stay is around, on the average, is around 2 weeks length of stay. For mild dementia, the cost is about 2,300. With a mean length of stay about 10 days, and for moderate dementia about 2,600 USD with a mean length of stay of 12.1 days, and the severe dementia about 3,346 with a mean stay of about 2 weeks, about 15.5. So roughly the cost of looking after a person with cognitive impairment for around 2 weeks in Malaysia varies from about 2,003 to a max of 3,350, depending on the different stage of dementia. So that gives us roughly how expensive it is to look after a patient with cognitive impairment. Right. Okay, so we go next to long-term care funding. 2 types again, public nursing homes, of which 100% are fully government subsidized, and in the private long-term care facilities, you have to again pay out of your pocket. There's no insurance that covers long-term care facilities at the moment. The SOCSO, which is the Social Security Organization, do provide long-term care, but only to those with disability while they are still in employment before they reach the age of 55 years. They will pay for the long-term care service. So if you have dementia after the age of 60, then sorry for you, you have to find your own payment. But if you have dementia before the age of 55, while you are still employed, they will pay for your long-term care. Right, a bit funny. Right, so the tour study that I mentioned earlier also include 2 long-term care homes, but the results are still not ready as yet. They're still doing the study, but in calculating the cost of long-term care, this should be taken into account, your healthcare component, accommodation and living expenses, as well as your personal care. Okay, so I am finishing now, right? So in conclusion, Malaysian dementia services is still very much in its infancy. Our main problem is the resources. We are lacking in terms of manpower, facilities and financing. There have been feeble attempts, I said feeble because the government doesn't seem so serious about it, at drawing up policies for elderly care. But there's no attempts to draw up a national dementia strategy, right? The tour project is in the right direction, at least to attempt to cause dementia care, but it should go beyond hospitalization and long-term care. I mean, they should find the cause of dementia care in the community as well, because the government sometimes respond to money. So hopefully we can get somewhere to push the government into action. The advocacy group at the moment, although they are Alzheimer's Disease Foundation, but they are not strong enough. So I feel that they should be empowered to improve to community resources. Otherwise, if we don't have all these in places, I'm afraid that Malaysia would have another disaster on her hand, okay, on top of what we have now. So thank you for your attention. 감사합니다. So that's my third Korean word.
예, 간단히 뭐 중요한 얘기들만 얘기하면 되게 한 7에서 8% 정도의 노인 인구가 있는 지금 말레이시아에서는 우리나라로 치면 아마 한 10년, 15년 전의 상황하고 비슷한 상태이긴 한데 아마 지금 현재 1차, 2차, 3차의 시스템을 가지고 접근하는 방식을 보면 우리 10년 전보다 나았던 것 같아 보이긴 합니다. 혹시 질문 있으시면 하시면 제가 대신 질문을 해드릴게요. 오케이, thank you.